Hi, I'm Fiona, the physio from pelvicfloorexercise.com.au, and today we're going to have a little look at how to use your Therawand. Therawands come in a vaginal and an anal form. The anal one is known as the LA, or the long anal, because it is a slightly longer curve to it, which allows greater access and easier access to the rectum. However, you can use an anal, smaller anal one like this vaginally for ladies who have a smaller vagina. What the wands allow you to do is to continue your treatment at home that you would have been receiving in the clinic with your physiotherapist. So when they've been doing manual therapy on the pelvic floor muscles, doing massages and releases, that's what you can replicate at home using your wand. What you need to think about is imagine your pelvic floor as a clock face. So if you think of the pubic bone as 12 o'clock, the left side is 3 o'clock or towards your left hip, your tailbone is 6 o'clock, and the right hip is 9 o'clock. So that will help you to orientate yourself. Your physiotherapist will have been doing some manual therapy treatment on you in the clinic using massaging techniques, and you're going to replicate that at home using your Therawand, which is the purpose of the wand, is so that you can continue your treatment at home and become self-managing. So just make sure that only you use your wand on yourself, because if someone else, a partner or so forth, is using it, they can't feel how much pressure they're putting on, they can't feel any pain that you're feeling. So it's important that it's only you that does the treatment to yourself. We're just going to have a little look with the vaginal wand. So the vaginal wand obviously is used in the vagina, and the anal one into the rectum. If you get yourself nice and comfortable, laying down with your knees bent is usually a good idea. Some people prefer, when they're using the anal one, to lie on their side because it's easier access for them. But again, still keep that clock face in your mind when you're trying to orientate yourself. Add a little bit of lubricant to the end of the wand. You can also pop the wand in some warm water, not hot water, but warm water, or you can pop it into the fridge prior to treatment, which might make it a little bit more comfortable for you. When you're inserting your wand, make sure that it's facing towards the pubic bone to start with, then as it goes in, you rotate it to the right or the left. And what this will do is bring the tip of the wand onto the pelvic floor muscles, exactly the way that your therapist has been doing it in treatment at home. You can then gently rotate and massage, or you can find those particularly sore spots and do some gentle pressure. Just make sure that you avoid directly doing pressure at 12 o'clock, because that's where your urethra is and you don't want to damage your urethra. And also avoid direct pressure down towards 6 o'clock, because that's where your rectum is, and again, you don't want to cause any damage to your rectum. So we're keeping to either side of those structures. Once you've finished your treatment, remove your wand, clean it in some hot soapy water, and then store it for your next treatment. Thank you for watching. If you have any further questions, please don't hesitate to email us on info@pelvicfloorexercise.com.au.